The area being assessed here is the spine, and the spine consists of the cervical, thoracic and the lumbar. And the safety setup involves the practitioner adjusting the height of the bed so that they can comfortably do the passive movements of the neck, so that it doesn't feel painful for both the practitioner and the patient. Another safety setup is to make sure that the practitioner, whilst taking the patient through the passive movements, is being extremely gentle and slow with the movement, as because if this isn't happening, then could result in damage to both the back and the neck. It is very important when doing a passive movement that the couch is being adjusted so it is at a neutral height based on the height of the patient, as if the couch is too high, this could result in the neck already being flexed or extended before even doing any movement. Movement of the cervical spine. Flexion, extension, side flexion to the right, side flexion to the left, and rotation to the right and rotation to the left. Ensure that the bottom of the feet are fully placed onto the floor when sat down, so that the legs are at a 90-degree angle, which is done by adjusting the bed until their heel touches the floor. Active flexion. This way you need to tell the patient to bring the chin down towards the floor. Passive flexion. To begin with, the client needs to be laid down on their back in supine position and shuffle backwards so their neck is off the couch. The practitioner needs to position their hands so they are placed around the back of the head of the patient and make sure that the patient is relaxed as possible. Once the practitioner has control of their neck, they now need to bring the neck into flexion by bringing the chin towards the chest. Active extension. This way, the practitioner tells the client to look up towards the ceiling. Passive extension. Once again, keep the same hand position as the passive flexion, but this time, instead of bringing the head down towards the chest, the practitioner will bring the head back towards the floor so the patient is looking at the ceiling. Rotation to the left. The client needs to look to the left-hand side and rotate and come back to the central position. Passive rotation to the left. Continue to have the hands placed around the back of the head, but this time move and rotate the head to the left side and then bring it back to neutral position. Rotate to the right. Client needs to look to rotate and look to the right-hand side and then come back to the neutral position. Passive rotation to the right-hand side. Practitioner needs to remain holding and assisting the head from resting both hands behind the back, and this time turn the head to the right-hand side, and then once in the rotated position, bring the head back to start position. Side flexion to the left. This is where the client needs to bring their left ear down towards their left shoulder and then back up to the central position. Passive side flexion to the left. Practitioner hands placed the same as the other passive movement, however they are now bringing the patient's left ear down towards the shoulder and back to start position. Side flexion to the right. This is where the practitioner gives the client commands such as to bring their ear down towards the floor and back up to the central position. Passive side flexion to the right. This is the same as a passive side flexion to the left, however this time the right ear is getting moved closer towards the shoulder instead of the left. When doing the passive movements, the practitioner needs to continuously check on the client by asking, for example, do they feel any pain, and when moving the neck, this needs to be done in a slow and controlled manner throughout. When all the movements are done, the practitioner needs to help assist the patient's neck back onto the couch and into a sitting position. Thoracic. To begin with, get the patient to sit on the bed so they are at an angle of 90 degrees at the hip and bring hands to the chest. Thoracic active flexion. Cross hands at the chest and bring neck down towards the chest. Thoracic active extension. Keep hands across the chest and push the sternum upwards towards the ceiling. Before doing this movement, the practitioner may need to explain to the client whereabouts the sternum is. Thoracic rotation to the right. Keep feet stable on the floor and continue to have hands across the body and rotate around as if they are looking behind towards the wall as far as they can. Thoracic rotation to the left. Once again, keep the feet stable and arms crossed at the chest, and this time instruct the client to rotate and turn around to face the wall behind at the left-hand side. Thoracic side flexion to the right. This is where the practitioner instructs the client to bring their right shoulder down towards the floor and then back up to the start position. Thoracic side flexion to the left. The practitioner instructs the clients to bring their left shoulder down towards the floor as far as they can, as long as it is comfortable, and then back up to the central position. Lumbar spine flexion. Client needs to place hands onto both thighs and then glide their hands downwards to the front of the shins down towards the floor as far as they can without bending the knee. Once the fingers are at the floor, the client now needs to glide the hands back up the shin towards the start position. Lumbar spine extension. This time the client will need to place their hands on the back of the thighs and glide their hand backwards down the leg and the back coming behind in the opposite movement of flexion. Lumbar spine side flexion to the right. For this movement, the patient needs to glide the right hand down towards the pocket and down to the right ankle. Lumbar spine side flexion to the left. This time the patient needs to once again glide their hand down towards the pocket and down to the ankle, but this time with the left hand. There's little rotation that is allowed at the lumbar, as the majority of the movement comes from the thoracic part of the spine. Lumbar rotation to the left. Patient needs to place hands cross over the chest and turn back towards the left side so the patient is looking behind at the board, and then come back to central. Lumbar rotation to the right. Patient places hand across the chest and turn to look behind towards the wall at the right hand side, and once looking behind, the patient now needs to come back to central position, and there is no functional test for the spine area.